Imagine a situation where there are more people in desperate need of a life-saving organ than there are organs available. How do medical professionals and ethics committees decide who receives this incredibly precious gift? In organ recipient selection, prognosis plays a pivotal and essential role. It is a critical factor used to determine the likely outcome of a transplant for a potential recipient, aiming to maximize the benefit of each donated organ and ensure fair allocation of scarce resources. The primary reason prognosis is so important stems from the ethical principles of beneficence and justice. Beneficence compels healthcare providers to do good and maximize positive outcomes. By assessing a patient's prognosis, the medical team can identify those who are most likely to survive the complex surgery, have a good quality of life post-transplant, and experience long-term graft survival. This careful consideration ensures that a single, altruistic gift can potentially save or significantly extend a life, rather than being given to someone who might not survive the procedure or for whom the organ would quickly fail. This also ties into justice, which seeks to distribute these limited resources in a way that is both equitable and effective. To evaluate prognosis, transplant teams conduct comprehensive assessments. These include reviewing a patient's overall health, the presence of other medical conditions or comorbidities, their current functional status, and their psychosocial support system. Standardized scoring systems are often used, such as the Model 4 and Stage Liver Disease Score, known as MELD, for liver allocation, or the Lung Allocation Score for lungs. These tools help objectively quantify the urgency of need and the expected post-transplant survival, although they are always considered alongside a thorough clinical evaluation. An important aspect of this process is distinguishing between a patient's short-term and long-term prognosis. While immediate survival of the transplant is crucial, the long-term outlook for a productive and healthy life is also heavily weighed. This nuanced assessment helps prevent the ethical dilemma of futile care, where a transplant might offer only a minimal, very temporary benefit. The goal is always to find the best possible match for maximum sustained success. Ultimately, the careful consideration of prognosis in organ recipient selection ensures that the incredibly generous act of organ donation translates into the greatest possible positive impact. It helps us navigate complex ethical waters, upholding the values of fairness and stewardship over precious resources, leading to improved survival rates and better quality of life for recipients, and honoring the donor's gift.